Welcome! Today we are going to discuss the features and benefits of the Merit Endotek AEROmini Tracheobronchial Through the Scope Stents. This system allows the placement of 6mm by 10mm and 6mm by 15mm stents visually using a therapeutic bronchoscope. The Merit Endotek AEROmini Tracheobronchial Stent system is comprised of two main components: the radio-opaque self-expanding nitinol stent and the delivery system. Some of the key features include radio-opaque and visual markers, both at the distal tip and the green marker proximal to the stent. Self-expanding, fully covered nitinol stents in 6mm by 10mm and 6mm by 15mm sizes. 110 cm length catheter. Stabilizing sheath to reduce distal movement during deployment. Trigger handle deployment system. The AEROmini Through the Scope system requires a 2.8mm or larger working channel. One of the key features of the system is the stabilizing sheath. It has been incorporated into the AEROmini Through the Scope product to reduce distal movement and friction during deployment of the stent. To use the system, the catheter is inserted into the 2.8mm or larger working channel of a therapeutic bronchoscope. Ensure that the stent has completely exited the distal channel of the bronchoscope by visualizing the green proximal marker. Once the stent is in the desired position, gently hold the stabilizing sheath at the entry into the working channel of the bronchoscope and immobilize it during deployment. Hold the hand grip in the palm of your hand. Using your index and middle finger, grasp the trigger. Slowly retract the outer sheath by pulling back on the trigger until the trigger touches the hand grip. The green proximal marker is 4mm in length. The distal end of that marker is above the proximal end of the stent. Try to keep the entire green marker in place as you slowly pull back the trigger handle to deploy the stent. Confirm bronchoscopically or with fluoroscopy that the stent has completely deployed and expanded. Carefully remove the delivery system from within the expanded stent, using care not to move the stent with the distal tip of the delivery system. There is further information in the AEROmini IFU pamphlet. For further questions, please contact your Merit Medical Endotek sales representative.